Welcome to the Two Michaels podcast. I'm Michael Simkin, and I'm here with my host, Michael Leshner-Fleckenbrücken. Welcome to the Two Michaels podcast. I'm Michael Simkin, and I'm here with my co-host, Michael Bloom. And today we're lucky enough to be talking to Roman Palitsky about a super interesting subject, which is psychedelic therapy. I'd like to start by saying that a lot of us have got experience of one degree or another with psychedelics on a recreational level, but there's a big difference between that and psychedelic therapy. So Roman, can I start by asking you to tell us a little bit about your background and your work and why it's important to you?
Sure. First of all, such a pleasure to be with the both of you. So my training is as a clinical psychologist. And right now I have a number of roles that I juggle at Emory. I serve as director of research projects in their spiritual health program, but I'm also faculty in the Emory Center for Psychedelics and Spirituality, which is really sort of a unique entity. It's a joint venture from the psychiatry service at Emory and the spiritual health department. Really kind of coming together really around this insight that a lot of the impact of these psychedelic experiences and psychedelic therapies tends to involve the existential and the spiritual dimensions of people's lives. So that is a big part of where I do the psychedelics work that I do. Also, I have a background with a master's in divinity, which seems to be sort of idiosyncratic to the U.S. and maybe parts of Europe as a degree type. But it's training in religious studies, and in my role now, I really get to kind of be in the sweet spot of all the things that I kind of really care about and I'm excited with.
It's amazing.
What's Emory? Sorry, what's Emory?
So Emory University is a large private university in the city of Atlanta in Georgia. So it's sort of it's an old Southern university that is really kind of located, kind of jigsawed in up against the CDC. And so there's a lot of health and humanities work that's happening at Emory University. So that's the institution that I'm with now.
Sorry for my ignorance. What's CDC?
The Center, thank you. The Center for Disease Control, and so this is the federal U.S. agency that, when there is an Ebola outbreak somewhere in the world, they're the ones that are thinking about how do we sort of contain this. When there's some kind of respiratory pandemic, for instance, they're the ones that are handing out guidelines, and they do a lot of. Yeah,
a lot of what? Sorry.
They do a lot of the public health and disease research.
So the importance. What's the importance of having that university? I'm guessing that the fact that it's close to the CDC means that they can influence the CDC in a positive way to approve psychedelic drugs as therapy.
Well, the CDC doesn't do drug approval, as far as I know, but there's a lot of opportunities to collaborate. There's a lot of joint work that happens between folks at Emory and folks in the CDC. It's a very nice strategic place to be.
Mm-hmm. Good.
So it's like in relatively recent years that this whole opportunity for psychedelic therapy has come around with various legalization in various jurisdictions. What's the big deal?
That's a good question. I'm actually one of these people that likes to tone down how big of a deal it is. So It's a big deal for several reasons for a lot of people. One is that these are substances that have been historically criminalized that I think have no business being criminalized, and that it's sort of been kind of a baffling move to me to prohibit and make so restrictive these substances. To the point that people can spend jail time. So one reason that it's a big deal is for folks who care about this sort of thing, moving them into therapeutic domains really changes how we look at these substances and changes social responses to them, not only in the US, but sort of worldwide. We have this movement in Australia to allow psilocybin for therapies. We have some movements across Europe, and hopefully if that takes hold, I think it would be good news overall. It's also a big deal because as therapeutic agents, they really do seem to have striking impacts for really transdiagnostic groups of people and classes of complaints that have really struggled to be addressed by mainstream psychiatry and psychotherapy. So we have a lot of really great therapies that are developed, either psychiatric, pharmacological. They save a lot of lives. Psychotherapy does wonderful things, but the rates of healing and improvement, it's no secret. We could be doing a whole lot better. And then come along these psychedelic substances, which it's sort of been a little bit of an open secret in some ways, right? Where people seem to improve their symptoms. So we have these really mind-blowing early trials where, over 50% of people with chronic PTSD or with treatment-resistant depression see improvements in their symptoms. This is unheard of. And then, of course, as you see in any kind of early drug research, any early therapy research, you tend to have huge mind-blowing effects. And then as you sort of progress in the research and you have bigger studies, better controlled studies, the effects dampen a little bit. They're no longer as sort of astronomical, but still way more impressive than a lot of the things that we can offer folks, especially folks who have failed prior treatments. So that's a really, really big deal.
Cool. I hear two different phrases used: psychedelic therapy and psychedelic assisted therapy. What's the difference?
This is a little bit of this has become kind of a contentious issue, especially recently. So there was a commentary published just a week or two ago in the American Journal of Psychiatry from its editors with a sort of a cheeky title, Must Psilocybin Always Assist Therapy?
Yes,
so,
definitely.
It's and they're really asking, why is it psychedelic assisted therapy? Why aren't we just recognizing that psilocybin is the therapy, and whatever you're doing along with it is support, right? Which is an argument worth taking seriously. But the idea behind psychedelic assisted therapy is this sense that there are actually two treatments that are happening alongside one another and that are kind of synergistic, right? You have the psychedelic treatment, which has its phenomenology, this direct experience part, the trip, which is impactful, and then the days after the trip, which are impactful. But there's also a therapy component that is also an important aspect of the treatment. Together, they're kind of a whole is bigger than the sum of their parts type of thing. Just as psychedelic assisted therapy. Psychedelic therapy in general would include that kind of treatment, but it would also include coming in and, getting your ketamine infusion if you consider ketamine to be a psychedelic, or, going in and having getting your psilocybin in a pill with somebody who's, just there to sort of make sure that you don't do anything risky, and then going on with your life. The reason this is a big deal, I'll just sort of add, is right now there's a movement with huge stakes to approve psilocybin through the Food and Drug Administration in the U.S. And in order to approve a treatment, you have to have an indicated use. So if it's approved as not psychotherapy, it actually makes it much, much, much more easier for pharmaceutical companies to run with it and say, sort of start to administer it. If psychotherapy is a required part of the administration, as part of the indicated use, then there's all of these extra costly hurdles that stand in the way between you having the psilocybin as a drug that you manufacture and getting it into the hands of consumers.
Yeah. Clear. Let's get more specific with the actual psychedelics. I would like to, I'll just throw a few. So MDMA, magic mushrooms, ketamine, peyote, which is mescaline, ayahuasca. I'm just trying to remember stuff that I took proudly and changed my life in a very positive way. So yeah, let's start maybe by MDMA. What's your take on that?
In general,
for therapy.
Again, I think there is good, strong evidence that MDMA is helpful for a number of conditions. Primarily, the most impressive evidence is with PTSD, I think. And some of that research is happening in my institution with veterans who have had PTSD that it's resistant to treatment. I'm not sure. It's not always included in the psychedelic pharmacon because it's not there's these classic psychedelics, which are the serotonin HT2A receptor, which bind to that receptor, and MDMA is not one of these. So the classic psychedelics would be something like psilocybin, like LSD, which have this kind of action.
I think, it's important to differentiate between recreational use and therapeutic use, because to me there's a big difference. And where in a recreational setting, people might often use psychedelics actually as a way to avoid their pain, as a way to sort of jump up a ladder of consciousness and achieve a temporary samadhi, if you want to call that, to go beyond ego and be fully connected to the spirit or the source. After the effects wear off, they tend to return to where they were and basically wait till the next occasion where they can use it and again ultimately avoid really the real issue of becoming a whole person and facing the pain that they might be repressing. I'm interested in talking about what the difference is and what the extra work is to stop it basically being drug use - abuse and therapy. But on the lines of lots of people seem to be popping these stuff quite regularly and are still full of shit.
I think part of it is, again, so I am very much, I'm an advocate of, there is definitely, independent use with these substances is fine. And it's been very rewarding for me and it's rewarding for a lot of people, but it's not the same as therapy. And so for therapy, I do think there has to be therapy. I think there has to be a lot of the sort of therapeutic, intentional process with another person, ideally. But I was just having this conversation with a physician colleague who's, he has a patient who regularly takes ketamine as a party drug and is depressed as anything. And ketamine is supposed to have all of these antidepressant effects.
Exactly.
And he's wondering, well, should I send this guy to ketamine-assisted therapy? He already uses ketamine, and it's not doing much for him. And so my take is, well, maybe this is a person who is resistant to therapy in general, and this would get him into the therapy office. And, any of these things, it's really about the way that you use it. You were going to say something, Simkin.
I'm interested in the specifics of how it might look. Let's say if I was able to come to you for psychedelic assisted therapy, and we were going to use psilocybin rather than me just doing it at home by myself or with friends, how would it look? What would happen? What might the therapy be like? How would we make the psilocybin more useful?
Yeah. So the typical therapy approach with these substances is we would spend a number of sessions, let's say in a brief version, 4 sessions, where potentially you and I and one other person. So the model that we're using at Emory University is actually, it would be a mental health clinician and also a spiritual health clinician or chaplain as well. And the 3 of us would start by sort of getting an assessment of what's happening with you, what are the concerns, preparing for the dosing, setting intentions, giving you some tools for what to do as experiences come up. Really thinking about the relevance of, for example, we have a trial happening now involving cancer patients with demoralization. And pain is a very common issue in cancer, in demoralization, and can be exacerbated during the dosing. So what do we do when the pain comes up? If there is physical pain, what do we do when emotional pain comes up? How are we going to offer you support if you need it? Things like that. And really sort of starting to make an intention for the dosing itself. And then you come in, and for 8 hours or however long the 3 of us sit and you have the experience. We typically don't direct you. There is a music playlist, and you're invited to have headphones and an eye mask on so that you can kind of go inward. And afterwards, after that day is complete, there are, again, maybe 4 integration sessions that are just focused on processing your experience. And if there were challenging things, if there were difficult things, to how do we turn those difficulties into something that has real therapeutic value in your life moving forward? And if there were benefits, how can we offer you tools to move forward with your own life and keep those benefits in a way that enlivens what comes next?
Yeah, interesting. Can you give us examples of 3 examples without mentioning names? Like, say, 3 weeks ago, we had a woman. She was 56 years old. She had this, that, and the other. We actually decided to do psilocybin because of whatever reasoning. And then she came for 3 sessions, and then she reported whatever you're going to say. If you give us 3 examples of 3 different substances and cases.
Well, right now. This is just a psilocybin study, so it's not different substances. So just a kind of like a before, during, and after.
Please.
I'll talk about someone that I think would be. I'm a little bit sensitive to divulge information from an ongoing trial, but this is somebody who's already gone through the process of agreeing to have their information shared. So this is a person who has had a very difficult trajectory, had a cancer diagnosis that was, they were given a less than 20% odds of survival. Multiple surgeries, multiple recurrences. While going through this process, their father was diagnosed with cancer, and they sat with their father as he died, really just as dark of a pit to land in as any of us could imagine, right? And so this person came to the trial very demoralized, with a lot of challenges, but also maybe hopeful. Was one of the folks who said, I don't really know if there's going to be much of a spiritual dimension to what's going to happen with me. And then during the dosing session, I sort of uttered the words. I'm going to misphrase it, but I can feel that spark of light in me. I know it's going to be okay. Mourned their father, and really came out of the session really with an interest in, here's what I'm going to do. And actually what they were going to do is enroll in seminary. Spent the integration sessions really making sense of this experience and kind of putting the pieces together. But just sort of day and night, the look in this person's eyes, their again, they said, I can actually say that I'm not depressed, and I didn't think I would ever be able to say that again, which is just mind blowing to me.
Yeah.
What is so often people will take psychedelics and say something along the lines of, I met God. What is that? What's going on there? Why is this?
I don't know. It seems to engender these kinds of experiences. This is something, I was kind of racking my brains. I was giving a presentation at a conference recently, kind of talking about our sort of what we're doing and why we're doing it the way that we are with the spirituality, and racking my brains to sort of convey why this seems to be so relevant. And I was looking at our recent history of psychedelic science, which really, kind of Bicycle Day was in the 40s when Hoffman had his famous bicycle ride. Maybe, in the 50s, Gordon Wasson is talking to Maria Sabina and learning about magic mushrooms. Some experimentation in the 30s, but we've had like less than a century of what we would call sort of psychedelic research or science in the West. And it kind of struck me, looking back at the actual history of psychedelics. We have 1,000 years ago, Datura being used in the US, 2,000 years ago, evidence of magic mushroom use, 3,000 years ago, evidence of peyote use, 4,000 years ago, Amanita muscaria, and on. Going back, there's evidence from 10,000 years ago in Northern Africa of psilocybin use for sacramental purposes. And it kind of got me to borrow from geology. Geologists, they talk about this idea of deep time, right? That there is a scale of time, if you look at the unfolding of events, of geological events, that really humbles the human experience, that makes it seem irrelevant. And we can look at a deep time perspective on psychedelics that really dwarfs our own little, strivings to understand how these work. We have, 100 years out of 10,000 years of a history of sacramental uses of these substances. And it doesn't mean, it's not this kind of this fallacy that just because it's been that way is the way it's meant to be. But there is something there, something structural, that suggests that our encounters with these substances recurrently point us toward the spiritual. They recurrently invite something sacred. And I don't think that that's something that we should ignore as we try to use these in therapies. So what does it mean when somebody met God? Well, again, going back in this deep time span, right? God has been a lot of different things to a lot of different people. And I don't think that everybody's meeting the same thing, and I don't think that they need to be, right? But there is something that's happening where they're kind of piercing through the veil of their ordinary human existence and getting a glimpse of something that is transcendent, that is existentially significant, and that really orients them toward a bigger picture.
Yeah, definitely. I mean, I'd like to share personally. I'm 49 now, but when I was 28, I visited Amsterdam, and I'd never taken anything psychedelic before that or anything, maybe just smoked a bit of weed. And I took magic mushrooms, and my whole life changed completely till this very day. And I'm so grateful for that experience. I mean, I was hard-headed, atheist, and never believed in God, spirituality. I never thought there was a soul. I thought it was just something people made up because they're afraid of dying. And as soon as I took the mushrooms, 4 hours later, I was a completely transformed person. Until now, all I've been doing is reading spiritual books, Zen Buddhism, non-duality, Advaita, you name it, Eckhart Tolle, Mooji, Alan Watts, everyone. I mean, I must have heard thousands of hours of spirituality on YouTube thanks to that experience. I'm wondering, maybe you had something similar.
That is a profound change. I kind of want to flip the interview and ask you what you think led to that. Yeah, I have an issue. Is this maybe has to do with my background in the study of religion? This idea of a mystical type experience that the research community has really glommed onto, that like this is the thing that when it happens we really have these effects. And as a measurement construct, I think that's probably true. When you measure this narrow band of experiences, did you have a feeling like you were at one with the world? Did you have a feeling that you couldn't put into words, that time changed, that you had this like...
I took my watch off. Since then, I have no watch. Because I realized that time is just an illusion and it doesn't exist.
There you go. You had this classic mystical type experience, right?
Yep.
I do think we can think about this in a more broad sense, because there's actually, again, there's a lot of different kinds of mystical experiences. If you take ayahuasca, you may not be feeling at one with everything. You might be meeting other entities.
Yep.
You're not at one with those entities necessarily. They are other, right? For some people's experiences, right? That doesn't mean that this is not kind of one of these transcendent, moving experiences. So for me, I would consider these experiences have had profound existential and spiritual significance for me. But the thing that I often come to is kind of like so this is all there is, huh? Kind of a place.
What do you mean? What do you mean?
Like they're not, the ideas about the sacred and the divine and the sort of greater significance kind of melting away. And really it's almost a cliche, but what emerges is the moment, what we have between people, the feeling of time and existence pouring through this filter that is your human experience, and that's it. And that's really it, which is kind of profoundly moving and a little bit sad at the same time. And that's and beautiful, So somebody I know said, there's the most psychedelic thing I can think of is a bag of potato chips, and rather than all of this trippy psychedelic art. And I think this has a similarity to that, where for me personally, this has been very orienting, but it's not like I received like a great proclamation about how life is supposed to be lived or what the greater meaning is. It didn't look like that for me.
Yeah. It's like, what's his name? Terence McKenna. I think he said that when you're tripping, don't go for the big fish. Don't bring back these unbelievable understandings that you can't really go to the supermarket with. Bring small fish, something you can implement in your day-to-day life.
Yeah.
Well, he didn't quite say that. It was fruit, not fish. And he said, don't go for the high-hanging ones. You won't be able to carry it. don't go for the low ones, go for the middle ones, something that you're going to manage to bring back and relate to in your everyday state of consciousness.
Yeah.
Because there's some stuff that happened in a higher plane that it cannot be translated. Even if you were able to record it somehow, when you read it the next day or listened to it, it wouldn't make sense.
This is something that I sometimes that I got to experience with some ayahuasquero communities, where you will see, and a lot of the time it's the tourists that are coming in and come out of it like, I have had a vision. I have seen how things are. And a lot of the time they're very detailed and very intricate, and sometimes a little bit like, maybe conspiratorial, or, I kind of see the structure of these, hidden hierarchies and beings and all of that, or how our energy is supposed to progress through these levels or whatever, or I realize that this food is dangerous or whatever. And it's not like I didn't have experiences like that. I think that the gift that ayahuasca gave to me is it gave me a variety of divergent experiences like that, all in the same go, where it's like flipping pages in a book, like, oh, you can have this revelation or vision, or you can have that revelation and vision, or you can have a third revelation and vision. And they're all kind of visions, like,
It seems to me, I may be wrong, that ayahuasca is a more tricky substance, or DMT is a more tricky substance than psilocybin. And that if you wish to maintain various sorts of aberrations or delusions, it will gladly provide.
Wow. I'm not sure I understood what you just said there, Simkin.
I feel that in psilocybin there is a spirit. This is just my experience. I'm not saying it's any objective truth, but there is a spirit that tends to feel female, maybe somewhat otherworldly. And it cares. If I eat mushrooms, it cares about me. It wants me to heal. It wants to point me in the direction of being whole, telling the truth, accepting myself, finding my bliss, bringing my gifts to the world, using time wisely, unblocking repressed emotions, being a full and complete person. And I didn't so much on the experiences that I've used ayahuasca. It was mind-blowing, and there was all sorts of very difficult to describe experiences. It wasn't so clear, and it was much more difficult to bring a message out of.
It's a personal thing. It's a very personal thing. I'd like to ask Roman, from what I understand, ayahuasca is actual medicine. So you don't have to do any therapy with ayahuasca. I mean, you probably couldn't. You couldn't even talk to anyone. But the actual act of taking ayahuasca in a ceremony is the therapy. That is a therapy in itself.
I mean, these are sort of definitional things. You can call anything therapy or call anything medicine. It depends what you need from something in order for it to be medicine. I think in the traditional contexts where ayahuasca is considered medicine, people are not just drinking ayahuasca out of the blue without any preparation and without any integration, right? There are pretty sophisticated practices and dietas and all of these things, initiations that are part of that package. There's this wonderfully generative idea that really, in order for something to be a therapy, you only need a couple things. You need both people to believe that it's therapeutic. You need for there to be a process, and you need for there to be a connection between the people, right? But this idea, which is very influential in psychotherapies, actually comes from a study of traditional shamanic healing, where people can tell you the story of how the world came to be. And that is a therapy, right? But you have to have a mutual recognition that this is medicinal, that this is therapeutic. If somebody just accosts you on the street and tells you about the history of the world, you may not experience that as a therapeutic encounter. So we use the term medicine, and again, I think there's a little bit of transcultural, maybe slightly appropriative movement there, where we sort of see the enculturated use of the term medicine. I was like, great, medicine. It means the same thing as we mean when we say aspirin.
It's sometimes a euphemism for drug use.
Yeah.
In terms of when I hear sort of hippie people say the medicine is their justification for coming back again and again and again to eat the peyote or to drink the ayahuasca.
Yeah. Okay. How about LSD? We haven't spoken about LSD at all. One of my favorites.
LSD is, so there's an historian. I'm blocking on his name, which is a little bit embarrassing right now. But I can send you the name later. He's done this wonderful work that basically looks at LSD as America's, or the West's, not just actually Europe's, indigenous psychedelic. We have all of these anxieties around two things, really. This sort of like, these medicines are being sort of extirpated from their indigenous roots and used kind of inappropriately, or this kind of question of what is natural, right? Where some classes of substances, medicines, right, are natural and have these spirits, and others are, plastic. And LSD, like MDMA, often falls on the side of the sort of the manufactured ones. But this scholarship really looks at LSD as an indigenous tradition that comes out of Europe, that's kind of got all of the sort of saga of the Grateful Dead and the acid trips and all of this folklore and all of this sort of culture around it, that might be a sort of an authentic engagement with a psychedelic substance, but that didn't come from a plant found in the wild. So I think that's very cool. It's, there's not as much work on LSD psychotherapies in the clinical trials world. I just want to point out a lot of this work is ongoing with LSD and peyote and magic mushrooms and ayahuasca in the underground therapy scene, right? It's just that in the above ground scene, LSD has not had as much cachet, and I think it's probably for two reasons. One is the sort of artificial sort of boogeyman. And the other is, I just think it's sort of a prioritization that these large entities like Compass, which is spearheading psilocybin trials, have really put all of their marbles in this one basket and decided not to diversify, because it takes a lot of money and a lot of effort to get one substance across the legalization threshold.
Yeah.
But it seems to have a lot of very similar potential. It has evidence of generating neuroplasticity, of changing metaphysical beliefs, of all of these other kinds of improvements.
Yeah. Like, yep.
Well, I was interested about adverse effects, like in terms of psychedelic therapy, let's say using psilocybin. Where might it go wrong?
I think there's several places. One is, again, there are two therapies happening at the same time. Either one of those can have adverse effects. You can absolutely have adverse effects from psychotherapy, and you can have adverse effects from the substance.
Yeah.
When you marry those two, again, they can sort of interact. Some of the most important ones and most visible ones on the public scene have been inappropriate activity on the part of the therapists.
Yeah.
So, we know there's evidence that psychedelics increase suggestibility among people who take them. In therapy, I think that the suggestibility doesn't begin with the dosing. It actually begins from the moment that somebody walks into your office and says, please help me, I don't know what to do with this problem. They're giving over a lot of their agency to you, and it's very easy to be irresponsible with that trust.
Yeah.
Or maybe too easy.
Is it a coincidence that the word psychotherapist can be broken up into 3 words?
I mean,
Psycho, thera, and
pissed. Really pissed.
Exactly.
I see. What about bad trips? Has anyone ever experienced a bad trip? Like, I've had my fair share of bad trips, like really, really bad trips. Although somebody said once that there is no such thing as a bad trip. A bad trip is a good trip, only bad.
Can
and
you
I agree
describe,
because
Could you describe a bad trip?
Yeah, a bad trip is when everything is just so scary, and I want it to end, and I'm freaking out, and I'm people look strange, and I'm afraid that I won't be able to take it anymore, and it's going to be so strong. I remember on LSD, I was tripping once. It was awful. I just turned into light. I was just like this, waiting for it to end. Like really panicking. It was a nightmare.
Where were you?
In nature. With my girlfriend. I was always in a good setting. I know some people don't have that. I'm jealous even to this very day when I take magic mushrooms. I'm afraid. I only take 2 grams, 2.5 grams maximum, and I have friends who take 7 grams. I'd probably die if I took 7 grams. The point is, when I take my 2.5 grams, I always have this, at the beginning I'm afraid, because when it comes up, maybe it's going to be, I'm afraid of the fear, but then I overcome the fear, and then it's just bliss, and I love it, and I'm enjoying it. So has anyone ever freaked out in one of your sessions?
Yeah, this is not it's not uncommon to experience distress, sometimes very intense distress. There's a really great this psychotherapist and researcher Rosalind Watts has a wonderful painting that describes the trip process that involves kind of diving into this water. And it's this dive, or I personally think of it as a membrane, right, that you kind of have to pass through. And passing through, at least for me, is always a little bit of a fight. And the fight can get very unpleasant. When you've sort of popped into the other side of the membrane, for me, this is my own kind of idiosyncratic description, but like that's then you're sort of onto the other part. So a couple of things about what you say. Again, distress is not uncommon. In and of itself, distress during a trip doesn't have to mean that things are going to go badly, that things are going badly. Again, in the context of therapy, if you're doing therapy, you're probably going to be engaging with something that is hard or distressing. If you're interrupting an avoidance pattern, there's a reason that you've been avoiding the thing. Usually that reason is it's very unpleasant to engage with it, right? Now, engaging with a thing that's very unpleasant that you've been avoiding in and of itself is not therapeutic. I want to really stress that just because you're having a hard time touching the trauma or touching the grief doesn't mean that it's going to leave you in a better place. You need to be able to do something with it, right?
What do you mean do something? What could I do?
So a lot of it is about either finding some degree of new perspective, new level of acceptance, growing around it to accommodate it, right? Realizing, so when we talk about trauma treatments, a lot of the time, these avoidance patterns, they involve very unhelpful ideas about the world. People can't be trusted. I'm inherently a bad person. I deserve to have bad things happen to me. And what we do with it is when you can touch this experience, not react by avoiding, and kind of make an assessment that, this doesn't mean I'm a bad person. I never deserved for this to happen to me. It's terrible, right? That's the kind of stuff that I would call doing something with it. And if you can walk away with a new understanding of yourself based on that, that's great. It tends to reduce the avoidance. It tends to sort of change how we live. I do want to sort of take a little bit of a step back. You mentioned this, there's no such thing as a bad trip idea. This is not how, I don't think we should be saying it. I think we walk a fine line with therapies where we want to maximize people's expectancy effects. If you think a therapy is going to be good, it's usually going to have a positive effect. If you think a trip is going to be bad, come into it with a lot of fear, you are kind of increasing your chances of a fear-filled trip. But also, again, kind of going back to that suggestibility piece of somebody coming in and asking you for treatment. And I think we have to be very careful with taking over people's narratives in a way that makes us feel better about their experience. You didn't have a bad trip. You just have a lot of toxic behaviors and you're a bad person. And maybe when you stop being such a bad person, then you'll realize that this isn't such a bad trip after all. We don't ever want to put that on.
Well, quite right. Yeah. What would you say is like an ideal setting? But I'm thinking in terms of that Rick Strassman's research into DMT back in New Mexico all those years ago, where it was done in a very hospital-style clinic, and apparently people talked about how that affected the results.
Yeah, people hate that. Especially for folks like who we're working with. If you're working with a cancer patient or somebody who's had a history of medical problems, bringing them into a hospital or a hospital-like setting to do therapy is going to be tough. Unfortunately, that's the way it often has to be because of protocols, and we do what we can to sort of soften that. But it seems relatively unambiguous that, people will like nature. Like you said, Bloom, being in nature is sort of part of how you're thinking about set and setting, right? Having some freedom, I think, is a nice thing. Having support.
Yeah. I've supported people, who flipped in like trance parties in nature, and what I did, I just hugged them and I was there with them like a little baby, and it always worked. It was really good. Amazing experience to help someone else in distress. Yes, Simkin, you were saying something?
I'm thinking, I see a lot of training centers opening up, a lot of businesses that are specializing in training existing therapists to be psychedelic therapists. And I'm wondering, there's so many different types and so many different approaches. Will they all try the psychedelics that they're offering?
Probably not. It's a little bit of a debate. So there's a big contingent of people who say that you really need to have had this experience yourself. To be honest, I'm okay with this being an empirical question. I don't have a clear idea on whether or not a therapist needs to have had a psychedelic experience themselves. They should probably be familiar with non-ordinary states of consciousness, at least as they occur in other people, in a way that won't stigmatize them or make them feel judged or unsupported. But so one example, we just did a study with chaplains, with spiritual health clinicians who have administered psychedelic assisted therapy. And many of them have done these substances, but they refer to the experience of sitting people while they're dying as a very valuable well of knowledge and background, because again, these are non-ordinary states of consciousness that the other person is experiencing, and it shouldn't freak you out. It shouldn't impede your ability to offer compassionate support. So I think that, if you're able to, it's really like, I'm not as concerned about whether the therapist is whether they've had this particular experience with this particular substance. Are they able to be therapeutic in this setting? And does that experience help them to be therapeutic? And I think that's an open question.
Yeah. Somehow, personally, I find the idea quite concerning that a therapist would be providing a psychedelic experience and don't know what it is themselves. I would want my psychedelic therapist to deeply know what it is.
Well, that's a whole other story, right? You get to have preferences, and you should be able to find someone who fits your preferences. So I used to treat. I used to work in a veteran affairs hospital, treating veterans. I'm not a veteran. I've never been in the military. And a lot of people would really prefer for the person that they're talking to have had those experiences. That is a very reasonable, understandable preference. And when they have that, I'd rather they see somebody who's had those experiences. Is it a necessity for good therapy? Not for everyone, no.
Okay.
Would you say that, could you say who is this not for? Like a person who has this, that, and the other should definitely not go anywhere near psychedelic therapy.
I think we should step very carefully when we're talking about psychosis and related disorders. There seems to be, again, part of it is a little bit of like covering our own tuchus in a kind of we don't want we want to be as safe as possible when we're administering these things, and I'm wary of saying that any kind of health condition should bar you from something, right? It's because already having psychosis is so socially disabling. You're already excluded from so much a lot of the time. It's so stigmatizing. But the risk should be taken very seriously, right? That there is a possibility of exacerbating or triggering a psychosis-like episode. I think that, bipolar is another sort of condition that you probably want to be hesitant about. But I also, another side of this is, there are people with conditions that are seeking help with psychedelics that there's no real reason to think that this will help them. People with Lyme disease, right? People with, there's a lot of conversation about right now grief and complex grief, and I think it could be helpful for grief for some people, but it might, if it's destabilizing and if it's acutely after the grief, if it's acutely after a trauma, I'm not sure it's the best idea to jump right in and and stir the pot. Yeah. So I think. There's a lot of interest in using this as a sort of a blunderbuss to treat absolutely everything under the sun. And I just don't like ADHD. I don't know if psilocybin's going to do anything for your ADHD. I'm not sure why it would. You might feel your life is enhanced in other ways, but that's not related to ADHD treatment necessarily.
Yeah. We didn't speak about microdosing.
Yeah.
What's your take on that? It's quite a popular thing, I hear.
It is. I guess my take on it, and I'll have to hop off pretty soon. I don't know if there's any good evidence behind microdosing. On the face of it, it's really interesting that people who seem to really not want to take antidepressants often are really drawn to microdosing. And what they're doing is they're taking a small dose of a substance that interacts with their serotonin system, right, on a daily basis, which is essentially taking an antidepressant. So if you have issues about the dangers of antidepressants, you might want to be skeptical about microdosing as well. But it's interesting. Again, I think it's this whole natural thing.
Yeah.
Okay. Yeah.
Clear. Do you have a final message, since you have to go, for our viewers, maybe, before we wrap it up?
I think it's important to treat these things with some degree of reverence and some degree of care and concern. Be careful who you trust your experiences to. And be gentle with the way that you offer them to others.
Cool. Simkin, the final word.
Thank you for talking to us, and a super interesting perspective, and it's really good to hear from you.
This
Indeed.
has been such a great conversation. We could have gone on for much, much longer. I wish I didn't have to cut it off. But yeah.
All good.
It's been a pleasure. Good luck, and thank you for watching. Bye-bye.
Enjoy. Bye.